My focus this month is on Biogen, who just launched a new Alzheimer's drug, and it's priced at $56,000 a year. And would you believe that infusions actually cost more in addition? So many would call this extremely bold pricing. Biogen CEO, Michel Vanazzo, he explains, we've established a price for Adulam that reflects the overall value that this treatment brings to patients, to caregivers, and to society, and one that enables continuous innovation. So he adds, currently available therapies are only treat the symptoms, but they don't really target the underlying process of Alzheimer's, which this one does, the accumulation of amyloid plaque in the brain. So it doesn't cure it, it doesn't reverse it, but it does slow it down, and there's a huge value to that, especially because there is about 6 million of us Americans that now have Alzheimer's, and it's expected to go up to 13 million in the next 30 years. So as we get older, we're more susceptible to this disease. So why is this my curious and quirky topic? I think it's rare to find an example of true value-based pricing. And there's about 3 ways that you can price. You can price based on cost. You can, especially as Alan's saying, costs are going to be a huge variable. You can price based on competitive pricing, or you can price based on customers' perceived value. Most of the companies actually kind of get stuck or end up pricing based on those first 2, based on the cost or based on competitors. That third one, there's a clear advantage to it. If you can price based on value-based pricing, like we're talking about here, you can actually get rewarded for delivering true value. So Biogen somehow assessed the value of the market, and then they priced their products based on what customers were seeing in the value. But it's hard to do this because first you have to identify those customers. And the customers in this case, as the CEO said, was that they were the patients, they were the caregivers, they were society. They didn't even mention some of the other ones like the physician or insurance. So those are other stakeholders that, are part of this scenario. And then not only that, but then you have to take and figure out how to measure the value of stakeholders. So even if you have one stakeholder you're trying to measure, it's hard, but you have all these different ones. So how do you do that? And one of the ways is what we call the absence of that product or service. And what Vanazzo said was, he said that the cost of not having this, or what's happening right now in the market, is about $500,000 per patient per year. So, and about 600 billion for the US overall. So extremely expensive. So you can see some of the frames that they were using as they were trying to figure out what is the value to everyone in this case. And this is kind of a weird reference too that was made, is that it costs about $5,000 more than tuition at Harvard. That was another reference that they made. And it is, as we talk about pricing, it's an art and a science, as you can see in this example. So you may not have an advantage introducing a revolutionary new drug or providing trips to outer space, but you can relook at your pricing based on this example. So can you start to assess the level of value that your product or service is providing through your customer's eyes? So what you end up with is you may not charge that price, but at least you know what that upper limit is. Then you can look at what's going on with your cost, and you hope that your value is higher than your cost, or you have a big problem. And then you can lastly look at the competition and see within that frame of reference, if you are providing something that is differentiated, maybe it's not as revolutionary, but it is differentiated, you have pricing power, so you can charge more. Thank you.